I am on the second day. It's almost all done.
Yeah.
The LTC 100 in Scottsdale. And I am talking to...
Arash, CEO and co-founder of ClearPole.
Oh, okay. And so we're big fans of AI already. So talk to me a little bit about what ClearPole does.
So ClearPole is a multi-product AI platform that generally improves compliance and quality in healthcare facilities. It boosts your 5-star rating, and it helps with reimbursement when it's tied to quality.
Okay,
Yeah.
So talk to me, just sort of walk me through how it works and what it does.
So we have 3 prominent platforms. One is our conversational AI system that can conversate with your EHR, with your internal records, your policies and procedures, your contracts. And then we have our clinical platform that can monitor everything in your EHR, the notes, the monitor, and make sure that you've done everything according to best nursing practice standards and so on. And then what we talked about on stage, I don't know if I covered it yet, but the reactive side of what we do, which is once an issue has happened, help you with the plan of correction process and submission to the state, so that you get them off your back, and then it also makes sure it doesn't happen again to you.
So it's really, I actually, as you were doing your presentation on stage, I was really intrigued by the idea, and it's sort of like, almost seems like a no-brainer, right? You take your documentation from a survey telling you all the things you did wrong, right?
Yeah.
And you put it into AI and say, write the plan of correction for me, and it comes out.
You don't need to say anything. You can just upload it and it'll do it. The key, though, is that it needs to be rooted in the source of truth and not generic. Oftentimes, you're going to get in trouble just putting in a generic AI and asking it to write very specific sniff allegations and it needs to respond. So we've built a system that's guardrailed properly. It doesn't submit anything for you. It is rooted in the regulations. It's rooted in your policies and procedures. It brings in all that research that you have to spend time doing. It's not just saying write it. It's like you have to do the research, give it the proper data, and then have it write it. So it's just as simple as drag and drop, and everything is done. On top of that, we monitor all the surveys in all your facilities. So let's say you have 200 facilities. We can see what's happening in every state, every region, and give you...
So it helps you sort of see if you got problem patterns
exactly in your facilities in certain regions or certain,
Right. So talk to me a little bit more about the conversational stuff. So is that for like doing documentation?
It can. So the conversational tools that we're building are very open-ended. Through our implementation process, now we're approaching close to 1,000 facilities that we worked with, and our customers of ours. So the things we realize is that you got to build. Every sniff does things differently. Every role does things differently. So there's infinite needs. And so what we've built is a system that can not only adjust to the person, but also the facility and the data for that facility. So like ChatGPT, it's like infinite use cases, right?
Okay.
I can't even predict all the use cases, right?
So this would be available to team members, and they could sort of ask it anything.
Yeah. I can say an example. So
give me some examples.
So we had a facility in a location where there was a regulation that said that you need to have all the medical necessity for any psychiatric medication that your patients are on or residents are on. And so this is a hard task where you have to go to the EHR, find all the patients that are on psychoactive medication, find the medical necessity, open up Excel, put that together. And before that, you had to research the regulation, correct? So that whole process can be done in one chat window, from the researching to the regulations to then asking for like, do I have any residents with, and then make an Excel file for me of the patients, their names, the medication, and the reason. So like that whole process is something that could take hours to get done in 5 minutes. Right.
So, are you doing this for only skilled nursing? You're doing like assisted living, memory care, that side of things?
So we service, it depends what product you're talking about. But for example, for our POC product, we service from acute care hospitals all the way to assisted living.
Okay. Cool.
pretty wide range.
Okay.
Yeah.
Cool. And how do people find out more about this?
So please reach out info@clearpole.com, CLEARPOL.com. Stands for Clear Policy.
Mm-hmm.
We have policies.ai, but we still have the domain. But I guess AI is a country's
Right. Yeah.
yeah. So it's So regardless, you just reach out to us at ClearPole, info@clearpole.com, and we'll be happy to help you.
Okay. Cool.
Yeah.
Appreciate it.
Thank you so
Thanks
much for your time.
Take care.